Hello, I'm Dr. Aruna Kalra, Director Ops and Gynae Department at Birla Hospital. What is the role of gynecologist in reproductive organ cancer or gynae cancers? Gynecological cancers are cancers arising from reproductive organs. Every year, more than 60,000 females are suffering from gynecological cancers. It can be arising from uterus, cervix, vagina, vulva, or ovary. The most common reproductive organ cancer is uterine cancer, in which patient presents with postmenopausal bleeding or intermenstrual bleeding or pelvic pain constantly. Patients who have PCOS, diabetes, hypertension, or if they are taking hormone replacement therapy, they are more prone to develop uterine cancer, or patients who are on tamoxifen for breast cancer. Second common cancer is cervical cancer. Cervical cancer, patient presents with foul smelly vaginal discharge, postcoital bleeding, pelvic pain, burning urination, or frequent urinary tract infection. Human papilloma virus is the causative factor for cervical cancer. Next cancer can be vulval cancer. Any vulva growth on the vulva or unhealing ulcer or a white thin patch of skin which is persistently itchy can be cancer of vulva. Vulval cancer again can present with either foul smelly discharge, bleeding, or frequent urinary tract infection. Vaginal cancer, again, causative factor is human papilloma virus. Patient presents with postcoital bleeding, painful intercourse, or foul smelling discharge. This cancer is cancer of older age people, and again can be prevented by giving vaccination against human papilloma virus. Ovarian cancers can be many types: epithelial, germ cells tumor, and patient presents with bloating of abdomen, swelling of abdomen, or frequency of urination. The role of gynecologist is to teach patients for regular pap smears, regular ultrasound to see endometrial thickness or ovarian volume. Teach them that human papilloma virus vaccine is required for young girls and for every female who is less than 45 years of age. It will protect them from cervical cancer, vulval cancer, and vaginal cancer. We should be suspicious of every lesion we see. If patient presents with unhealing ulcer or a patch of skin which is itchy, or abnormal vaginal bleeding, or foul smelly vaginal discharge, we should be suspicious that it can be cancer, and we should do appropriately either biopsy of that area, hysteroscopic DNC, and biopsy to test whether it is cancer or not. We should ask for all the tests, whether it's ultrasound, pap smear, MRI, CT, or in case of ovarian tumor, all the cancer markers, blood tests, to test as soon as possible if we are suspecting any kind of reproductive organ cancer. Once the diagnosis of gynecological cancer is made, we should curate a treatment plan with the help of gynecologist and oncologist. Thank you.